So, how long should dental implants last? I mean, they should last forever, right? They're super expensive, probably the most expensive thing that you can have done at the dentist. Why don't these things last forever? Now, the first thing to appreciate with a statement like this is that just because something is expensive doesn't mean it's the best option. A dental implant is by far the best option if you have a missing tooth, but the free teeth that we've all had from the moment they came out, that is way better than an implant. And I appreciate that not everybody is born with a full set of teeth, in which case dental implants are great for them. But a lot of the patients who I see did have great teeth, and their teeth could have been just aligned and straightened, and it would look fantastic. And if they were maintained, they would still have those teeth. But for whatever reason, they have deteriorated over time. So whatever we're looking at is a second best option. Nature's own teeth are the best. Anything man-made is a second best option. So it's important to realize that. And if nature's teeth didn't last forever, it's hard to expect a dental implant or anything, dental veneers, crowns, whatever it is, to last forever. Now let's take a look at what we're asking of a dental implant or a crown, a bridge, veneer, whatever it is. It needs to be structurally sound. And by that, what I mean is it needs to be able to withstand constant use. Okay, there's very few things which are constantly in use, but teeth are pretty much constantly in use. And they're put under a lot of stress when we chew and eat, and sometimes when we talk as well. The teeth come into contact. Now, you're able to produce a massive amount of force if you were to clench your teeth. Now, luckily, most of us don't clench our teeth. Some people clench at night. But our teeth aren't under a massive amount of force. But it's not the massive forces which break things. It's actually the kind of the low grade forces. So when we chew and we eat, sometimes there's a bit of a tooth which catches, and you may or may not be aware of this, but say an implant tooth is catching. We call this an interference with a normal bite pattern. So when we chew and we eat, we don't just go up and down, we go sideways as well. And it's those sideways motions that if the tooth is catching on there, then over time this can cause a problem. And sometimes this causes the actual implant to fracture. Like we can see here, the implant kind of looks like a flower now. It's fractured in so many ways, but also the tooth itself can break. So I'll come onto the tooth breaking because that's an easy fix. But the other thing that can happen is you can get bone loss around the implant because of the abnormal bite forces that we get on the implant. Now it's important to realize this is different to gum disease, although even with gum disease you're going to get bone loss around the tooth. But this is just one way that an implant can fail. Now, the other thing an implant has to kind of withstand is bacteria. And bacteria is a big one because bacteria is the root cause of all dental problems, or the vast majority of them. So we've got gum disease and we've got tooth decay. Both of these are caused by bacteria. Not the same bacteria, but bacteria. And even in a perfectly healthy mouth, somebody who cleans their teeth absolutely perfectly and with no bleeding, no sign of any disease, there is bacteria in the mouth. So the important thing to realize about bacteria is that it changes over time. Let's say we were able to completely sterilize somebody's mouth so there's no bacteria. Within a few seconds, bacteria would get there and they would start sticking to the hard surfaces of the teeth. And the truth is, if you forgot to brush your teeth for one day, nothing bad would happen, okay? It's a little bit dirty, right? And the people who you're talking to might say otherwise because of the smell. But over one day, you haven't developed harmful bacteria which start causing gum disease. Okay, if you stopped brushing for a few days, a good majority of us would start developing the harmful bacteria, which then causes gums to bleed, which then causes eventual bone loss around teeth and implants. So The implants themselves a lot of them are designed in a way to minimize this bacteria going down to the actual implant, because that junction where the tooth and the gum meet, that's always going to be the weak point. That's where the bacteria from the mouth can enter into the actual implant system. Now, if you watch my videos on different types of implants, you'll know there's a whole bunch of different implant designs. Some are better for aesthetics, and some are better to protect against gum disease because they have a smooth surface which comes all the way up to the gum. Now, this is really important. No matter which implant you have, that junction where the implant is and where you can start to see the tooth, the emergence part of the tooth, it's all not visible. Okay, so as a patient, you would never see this junction, but it has to be really, really smooth because it needs to be cleanable. If it's smooth, you can pass floss down there and you're not going to break the floss, and it's just going to clean out that bacteria. So if you've developed the harmful bacteria, it's really easy to go back to square one and just have it clean, or when I say clean, I just mean not have the harmful bacteria on there. And this is going to help protect your implants against bone loss and gum disease. Now, I sometimes see patients who have had stuff done, and typically they've gone to the cheapest person to have this done, whether it be here or abroad, wherever, and we've got these massive, what we call overhangs. We don't have a smooth surface all the way from the tooth to the implant. Now, this is caused when the clinician chooses a suboptimal, I think that's the nicest way of saying it, way of putting a tooth on the implant. Okay, they want to cut costs because they are providing a low-cost treatment, and they have to make the tooth kind of look like a tooth, but as a patient, you wouldn't really know the difference between a tooth which is perfectly well-fitting and smooth to one which has this irregularity underneath the gum line. Especially if you're traveling abroad to get cheap stuff done, the clinicians there have no incentive for long-term care. So they will just use the cheapest techniques possible, and quite often it results in this overhang. Now, the problem with the overhang is that it's very difficult, if not impossible, to clean. And some people will have no problem with this for the rest of their life, but some people, a good majority, over 50%, will develop gum irritation around here. So we're looking at inflammation. It just doesn't feel right. Sometimes it can bleed if you touch around it. And eventually this will turn into bone loss around the implant. Now, bone loss around an implant and a fractured implant are the two main reasons that we take implants out and basically start again. Now, the other thing, you might be watching this video because there is another occurrence which happens, which is just the tooth part of the implant breaks off. These are actually not that big a problem. Now, I understand that as a patient, this can be very concerning. It's always going to happen just before you're about to go on holiday, on a Friday, on New Year's Day or New Year's Eve, Christmas Eve. These are the times when these kind of problems typically happen. And the reality is that I would be thankful that something like the crown of the tooth has broken, rather than we have an implant problem like bone loss and implant fracture, because this kind of problem is really, really easy to fix. It takes maybe 2 weeks, maybe you have to have the crown remade, but it's a simple procedure which doesn't require any anesthetic and there's no healing time. Now let's look at a situation like this where the implant itself is broken. What we did in this case was we first had to drill out the implant, which is really, really hard to do. Sorry, I shouldn't say hard to do, there's a technique to doing it, but what it does, it leaves us with a big hole. Now, luckily in this case, the lady had enough bone that this wasn't such a big problem. So what we did was we put in a bigger implant in straight away. Now, bigger implants are less likely to break because there's more metal and more structure there. But at the end of the day, it still means this lady has to be 3 to 4 months without a tooth while this implant is healing, and then we have to remake a fresh tooth at the end of the healing period. So a broken implant, if you get a problem at the actual implant level rather than the tooth level, it's a much more complicated problem to fix. Now, ultimately, dental materials and techniques, and especially implant dentistry, have progressed massively over the last 10, 20 years. And there's a lot of techniques that we can use to minimize long-term problems, because I don't want my patients having long-term problems, because they're going to call me up and I've got to solve that problem, and we often don't charge for stuff like this. So it's in my interest to keep this to an absolute minimum, but it happens. Tooth fractures, when someone's having all on four, teeth can ping off. These are annoyances, but I'm glad that they happen at the tooth level rather than the implant level. Now, there's things that can happen on the other side, which is like, let's say, the patient side. So let's say you had dental implants and you're perfectly fit and healthy. There's things that can happen. You can develop conditions like diabetes, and it may not be well controlled. Your blood sugars may not be well controlled. This can affect healing. It can increase your chance of getting bone loss with gum disease. You might start smoking. Again, smoking is one of those things which we know makes gum disease worse and therefore puts your implants at risk. So there's all these things like what we call systemic conditions which affect the whole body, which can have an effect on our dental implants. And these are impossible to predict. Okay, you might have perfectly healthy implants for 10, 15, 20 years and then develop a condition, and the condition may go undiagnosed for a long period of time, and in that time, for some reason, the implants are now being affected. Okay, so it's important to take an overall view of this. The patients who are the happiest with treatment appreciate its limitations. They appreciate that nothing will last forever, but you can get a really good lifetime out of these procedures if one is carried out properly. But most people who do a lot of implant treatment will carry things out properly. And also, if you maintain it regularly, just have regular checkups. If there's an issue with an implant, often it's much easier to fix it early on rather than if you leave it for years and years. And like this lady who I saw earlier this week, and we've just got a big hole where an implant was. This is a much more complicated project. It's going to take at least a year until we can get the implant in. So, to put something like this right is a long process, not to mention an expensive process. So I hope this has enlightened you. I hope it helps you understand a little bit more about the realities of dental implant treatment. I mean, the vast majority of treatments I do are implant and surgical related, and I think it is a fantastic treatment if you have missing teeth. There is no better treatment out there. But like any treatment in any form of medicine, it has its limitations, and if you're aware of those, you can prepare for them mentally and just realize that even though it's super expensive, it's not going to last forever. So as always, guys, hope you found this useful. If you did, please give it a thumbs up, consider subscribing, and I try to regularly get videos out there which help people understand the realities of cosmetic dentistry. All right, guys, until next time, take care.